Hi, I'm Lindsay Davis. This case is from last semester at the Little Clinic. On 3/29, a 44-year-old Caucasian male presented to clinic with chief complaint of, I have constant sinus pressure and pain. Had sinus pressure and pain since 1/29, throat pain and cough present since 3/8, total discomfort level 5 out of 10. Sites of discomfort include right ear, constant in nature, has had occasional headaches, course of symptoms not improving nor worsening. History of sports-induced asthma, ruptured eardrums in 1990 with two placed in right ear in 2014, a septoplasty in 2008, sepsis in 2014, incarcerated inguinal hernia in 2003, and a mood disorder following war injuries in 1990s. Drug allergies include Lodine, Flexeril, and Floxin, which all cause anaphylaxis. Does take ibuprofen and Tylenol with no issue. Does have environmental allergies. Current meds include ibuprofen, Wellbutrin SR, Zyrtec D, and Tylenol. Denies sick contacts, drives truck for Excel, a non-smoker with no exposure, no life change, and married with good support. Review of systems: constitutional, no fever or chills, positive for fatigue. Neuro, no abnormal headaches. HEENT, no eye drainage or redness. Ears full with no discharge. Nose has rhinorrhea and congestion. Throat pain with swallow, no drooling or decreased range of motion. Pulmonary cough with productive green sputum. Denies shortness of breath, brown or bloody sputum. Vital signs, unremarkable. Blood pressure 138/69, repeat 126/78, BMI 32.09. Assessment: constitutional, no acute distress, appears tired. Neuro, speech clear, states date, time, location. HEENT, eyes with no inflamed conjunctiva or discharge. Ears with bilateral external canals without redness or discharge. Bilateral tympanic membranes intact. Fluid behind left tympanic membrane. Tube present in right ear. The tympanic membrane is red with scarring. Nose, turbinates, edematous, maxillary sinuses tender with palpation. Nose, mouth and throat with no signs of infection or tonsillar enlargement, and no pain with percussion of teeth. Neck with no lymphadenopathy. Pulmonary, clear breath sounds. Cardiac, regular rhythm and rate. So this is a 44-year-old Caucasian male in clinic having had sinus pressure and pain for 2 months with edematous turbinates and tender sinuses, likely sinusitis. Also problems of otitis media, cough, elevated blood pressure. For the sinusitis, we decided to give him a Z-Pak, 250 milligrams. Patient to take Mucinex, push fluids, rest, use sterile saline rinses. If periorbital swelling happens, to notify our provider immediately. Follow up with PCP or clinic if not better in 48 to 72 hours, and to follow up with ENT as soon as possible, and to take antibiotics as instructed. For otitis media, Zithromax should help. Use Flonase for eustachian tube dysfunction. No swimming. Again, follow up with ENT. For cough, saline rinses, Mucinex, antibiotics should help. If no improvement, may need chest x-rays. See provider immediately for chest pain, wheezing, or dyspnea. For elevated blood pressure, measurements obtained on 3 office visits. Prehypertension with greater than 120/80. Get rechecked with PCP. Avoid over-the-counter NSAIDs. Tylenol okay to use, and a salt restriction diet. At this point in rotation, wanted to evaluate antibiotic usage for sinusitis. This study was titled Amoxicillin for Acute Rhinosinusitis, was a randomized placebo-controlled trial based in 10 primary care offices in Missouri between 2006 and 2009 with 166 adults with similar demographics. Diagnosis primarily required maxillary pain or tenderness of face, teeth, and purulent nasal secretions for greater than 7 days or less than 28 days that were not improving. Study participants received 10 days of either amoxicillin at a daily dose of 1,500 milligrams administered in 3 doses per day, or placebo similar in appearance and taste and dispensed in the same fashion. All patients received a 7-day supply of Tylenol, Mucinex, Mucinex DM, pseudoephedrine, and saline spray for symptoms. At days 3, 7, 10, and 28, telephone interviews were conducted regarding symptoms and compliance. This was evaluated using the Johns Hopkins Scale, Strength of Evidence Level 1 for randomized control trial, and a quality rating B, good quality. Findings still, with 14% of people did not complete treatment. At days 3 and 10, neither group had a true difference in symptom improvement. Recommends avoiding routine antibiotic treatment for patients with uncomplicated acute rhinosinusitis. Antibiotics did not shorten, prevent recurrence, improve the satisfaction of patients, prevent missed days of work, or prevent complications from developing. The patient we had needed a different treatment plan, but this is good information to have in regards to the stewardship of antibiotics. Thank you.